only biped animal. That means is the only animal which walks on two legs. So the strain and load on the knee joint is maximum. When we walk on the straight surface or straight ground, then the load on the knee is about 4 to 5 times the body weight. If we sit down, squat down, or sit cross-legged, the load can increase up to 8 to 10 times body weight. Now imagine how much wear and tear must be happening all over, means all throughout the life. We walk millions of steps, and during that step, the joint wears off. So if you see, we have a model here. This is an adult young normal knee joint. The knee joint is made by the thigh bone, the leg bone, and then we have a kneecap in front of it, which is called as patella. Now here if you see, the surface of the bone is lined with cartilage. This blue lining is cartilage, which is smooth, and we have cushion in between these two, which is called as meniscus. Now as the wear and tear goes on increasing, this smooth surface turns into a rough surface like this. There are erosions, there are sorts of wounds inside the knee joint cartilage, and the bone gets exposed to each other, and that rubs on each other, giving excruciating pain, stiffness, and other disabilities to the man or woman who is getting affected with osteoarthritis. This osteoarthritis, people ask me why it is on increase. But let me tell them that it is increasing because of lifestyle, obesity. Number two is the longevity or the age expectancy. The life expectancy has increased in last couple of decades, especially India. About 2.5 decades back when I was studying medicine, that time we had life expectancy of 57, average life expectancy. Today it is around 75 and 77. So people are aging, and I think healthy aging is also very important. Anyway, coming back to the question, this number of arthritic patient is increased. But even if it is increasing today, arthritis and osteoarthritis has actually plagued the human race since very long time. Going to the history, let me tell you, there have been several attempts to replace this arthritic surface. If you see the history, there are there are old ancient history also. Like if we take example of Egyptian mummies, means many centuries back, they have found that there were attempts done to replace this diseased cartilage by various material. In 18th and 17th century, if we see, then there were attempts of there was a thought process that if you keep a biological membrane between these two moving bones, that can get transformed into cartilage. So there were membranes like intestine, the fascia lata or the thigh muscle, and then there were even attempts of putting pig's intestine also in between these two, and which obviously did not work that time, had very, very disastrous effects. Around say mid-end of 20th century, around 1950s, there were a lot of attempts of replacing this diseased cartilage with metal or materials like ivory, materials like glass or ceramic, something like that. But they were having limited success because that time we did not understand the overall functioning or biomechanics of knee joints. These ligaments, this prosthesis or early attempts, the prosthesis which was used was hugely bulky. They used to cut the entire bone here and put a massive, big implant made up of all metal, and so that had very limited life. I think after 1970s, success in total hip replacement, thanks to our father of orthopedics, Sir John Chanley, the evolution of joint replacement has taken big strides, and today we have such a fantastic science which is evolved and which is helping millions of arthritic patients. So today I think the technology, the total science of joint replacement has improved, and it has made a lot of progresses based on 3 T's, as I call it. First T is the tools, that means the equipment which we use. Earlier we had to use very bulky equipments, cut a lot of bone. Now we can understand how much bone is actually damaged, how much cartilage is damaged, and we can just use various tools like We have navigation, we have robotic surgery, we have ortho align, which is a handheld navigation systems. So all these technologies make the surgery absolutely precise and help surgeon to remove only the diseased part of the bone. So we can preserve almost all the natural normal tissues of the knee joint, and it is very obvious that the patient gets back to the normal whatever life and enjoys a pain-free life. The second is technique. The surgical techniques has evolved. The surgeons have learned through their experience. Surgeons have learned through literature. There is a lot of evidence which is there. There are various types of surgery, like we do now a lot of ligament preserving knee replacements, that is the cruciate preserving. So the techniques are also important. It's not only the machine which is doing that. So it is the surgeon who is also going to be very, very important. So the tools, the technique, these two things are most important. And the technology is also important. The technology has improved in terms of the metals, whatever metals what we are getting, that long lasting. They are thin, sleek implants, so they are not as bulky as the implants used in last century. So there has been a huge improvement, and all this together have contributed to most important thing is the longevity of the implant. That is the survivorship of the implant, which was earlier only 5 to 7 years. Now we have implants which can last for 25 years, 30 years. So that is a significant advantage and significant advance, in my opinion, in the science of joint replacement. So all these things have made joint replacement as one of the most successful surgeries in today's modern era. And especially addition of robotic has brought extreme precision in this science, and which helps us to get the prosthesis absolutely perfectly aligned, which adds to the life of the prosthesis. Also, robotic surgery, it reduces the amount of bone cutting, tissue cutting, and so the patient is back to the normal work in a very short period. So the rehabilitation time also is very less. So considering everything, I think a lot of arthritic patients who are just suffering because they are ignorant, they don't know about these advances. I think this sort of information will go a long way in helping these patients to have access to care and take a proper treatment.